Hello everyone and friends, Dr. Chernov here. Today we have Lyuba joining us as our special guest. Lyuba, hello to you. Hello there, nice to meet you. May I ask how old you are? You're 68, right? Now, looking at your chart, I see you came to me with a long list of various health concerns. Please tell us more about what's been happening.
What was bothering you? My left leg hurt a lot. My sciatic nerve was pinched. I couldn't bend my leg. The pain followed the path of the sciatic nerve and radiated straight down to my foot. The pain reached all the way to your foot? Yes. I was diagnosed with hip joint arthrosis. I couldn't sit in one place for long.
Were you told to prep for a new joint? Yeah, they did.
Chronic hip joint arthrosis is currently considered untreatable. My doctors have strongly advised me to prepare for a full joint replacement surgery. I sat down and talked with them about it. When speaking with various friends and acquaintances, they shared their personal stories and mentioned that after receiving their initial medical diagnosis, they underwent surgical procedures within a period of 6 months, a full year, or even longer than that.
Progression set the timing. Lyuba, your back also hurt. There were multiple hernias and protrusions of the intervertebral discs. You also came in with significant pain in your shoulder joint area. Yes, that is right.
My arms and shoulders have been hurting. Which shoulder hurts more? Is it the right one? Yes, the right one, especially that side. I couldn't even
I'd put my arms behind my head, but then I asked, up to what level could you raise your arm? It was only parallel to the floor. There was constant pain.
the persistent and chronic aching pain. It would appear in various different places, even at night while she was sleeping.
Let's show all of our viewers the improved range of motion that you currently have in your left hip joint. Before this, you were unable to even cross one leg over the other. Show us how the joint works now after being diagnosed with hip joint arthrosis.
And preparing for surgery. Before, I could only lift my leg with my hands and place it above.
Let's take a closer look at the knee. What exactly did we do to achieve such a remarkable result? We focused our efforts on working deeply with the various leg muscles. You see, the underlying reason for persistent pain in almost any joint, including the hip, is often a result of a prolonged and intense muscle spasm occurring within the thigh, the buttocks, and the surrounding connective tissues. We focused extensively on the lower back area and the surrounding regions. To achieve deep tissue relief, we utilized a combination of specialized massage rollers and firm massage balls. We meticulously worked through all the primary myofascial chains, including the posterior, anterior, and lateral muscle lines. We also took the time to fully relax the muscles of the foot and the lower leg. Lyuba, do you remember how incredibly painful and intense it felt at the very beginning? Yes, it was so overwhelming that I actually cried. Lyuba even had to ask me to take a short break immediately after we finished that part. Each movement, she said, "Let me go, don't torture me." But we kept working on the areas, specifically in the muscles where there was a lot of tension. Right here, in the vast quadriceps muscle area, the tension was definitely the strongest, especially on the outer lateral side of the thigh. Even now, there is still a bit of noticeable tension remaining here, but it is already significantly less. Now, when we work on this area, there is pain, but it is not as intense as it used to be. Let's take another look at how the left hip joint works. The area of the left piriformis muscle was a particularly problematic zone. It was extremely tense, like a rock. You couldn't even touch it. Naturally, at first, Lyuba couldn't. In the beginning, she really struggled to do this. She could only endure the intense pressure for 1 or 2 seconds before stopping the exercise entirely. Now, as you can clearly see, this entire area has become significantly healthier, much more flexible, and far more mobile than before. A chronically tense piriformis muscle very often causes direct compression of the sciatic nerve, which frequently leads to sharp pain in the buttock, down the leg, and even into the foot. Therefore, if you are experiencing any persistent problems or stiffness in the hip joint area, be sure to consistently work with massage balls like these to release the tension and improve your overall mobility. In the gluteal area, explore the gluteus maximus, gluteus minimus, and piriformis muscles. Do a high-quality, daily, and very consistent self-massage. Another problematic area was the entire left side of the lower back region. Here is where the Quadratus lumborum muscle is situated and located. At the beginning of therapy, Lyuba experienced extremely sharp and intense pain here. Now just look at her facial expression while performing. She has successfully completed the exercise and has truly learned to enjoy the process of self-massage. In fact, she mentioned that while it used to be intense, now it feels much more like a gentle tickle. Another essential tool I frequently use in my practice is a specialized wooden roller massager. I find it particularly effective when people come to me with pronounced pain in the lower back area or tension in the long muscles that extend the spine. I always emphasize to my clients that you need to work comprehensively with the whole body rather than just focusing on one spot to properly work through all the complex myofascial chains. In other words, if you have a problem with your leg or pelvis, it is essential that you also focus on the back muscles. Look for relax tense areas and restore muscle elasticity. This trainer is perfect for this, providing an excellent, gentle massage for the entire spine. Lyuba is already an experienced user. She couldn't even do it 5 times before. But just look at her now. This is simply an excellent result, isn't it? Friends, please take a look at Lyuba's forward bend right now. Just observe the incredible condition of her muscles. Lyuba, can you show us exactly how it was in the very beginning? How did you sit when you first came to see me? To begin with, I couldn't sit in this position. My pelvis wouldn't lower down to my heels at all. The muscles were very cramped and tense. The position was something like this. That's how it was at the beginning. Lyuba, can you show us again what you can do now? Look, now Lyuba can sit down completely and lower her pelvis onto her heels. This indicates an improvement in the condition of the lower back muscles and legs. The spine and joints have become more flexible. Working on this gives a very good comprehensive effect on double massage balls in combination with a wooden massager. This technique provides a much gentler massage effect on the spine, working on all the different segments of the back at once. Double massage balls provide a very targeted, localized effect. Right now, Lyuba is specifically working with a large double ball. It works the muscles at a wider distance on both sides of the spine. This small massage ball works much closer to the spine. It applies firm and consistent, steady pressure to the deep tissues. Strong pressure to the muscles, relieving them from spasm. You need to get used to it. If you have a pronounced to address this problem, it's better to start with the large double ball and the roller massager to warm up the tissue. Once prepared, you can then add work with the small double massage ball for deeper pressure. You can see how Lyuba is now working quite easily on the hardest double ball. That's because the muscles that were tight have started to release, allowing for deeper penetration and a more effective massage. That are located on either side of the spine have returned to a good condition. They no longer have the same amount. I focused on those areas of tension spots that were clearly there at the very beginning. This is roughly the process of how I worked with Lyuba's arms today. Take a look right here, in this biceps area, where you can see there is still a significant spot of tension left. We haven't completely worked it out just yet, so it still needs more time. There are two main methods of working through this. There's a fast one, which involves intense pain, and a much longer one, where we work more gently and slowly. Lyuba and I alternate between these two approaches. Between these two methods, muscle tension remains present, but the joint's range of motion has already recovered quite well. After working with the massage tools, we always did exercises with sticks, which allowed to fully restore the function of the shoulder joint in a short period of time. Now you will see a series of exercises that we did. I will record a separate video on how to properly work with a stick, but for now we'll just quickly demonstrate exactly what we did here. Lyuba, please show our viewers right now what truly amazing things you can do with just an ordinary shovel handle. Friends, take a close look. Just look at the absolutely excellent mobility in the shoulder joints she has now. Please watch and enjoy this demonstration. When Lyuba first came to visit us for treatment, she was struggling significantly and simply couldn't raise her arm above shoulder level at all. Please take a very close look at this area. All around the complex shoulder joint, the various muscles run in many different directions. When we work comprehensively with every single muscle in this specific area, including those in the front, behind, above, and below, we can effectively eliminate the deep-seated spasms within them. This thorough process eventually frees the joint from its restrictions and allows it to fully regain its natural, healthy mobility. The body, in its own remarkable way, then begins to move naturally and comfortably once more, in its own natural state. It begins to recover and renew itself very well on its own. So, Lyuba, please tell us once again exactly how long did we work together before we achieved such a stable, good, and noticeable result? Well, it was probably
A couple of months. A couple of months, friends. Then we had a short break, and after that we trained 3 times.
a week for an hour and a half each session. As you can see, Lyuba is now showing excellent results. Let's wish her good luck and success. I wish everyone good health. Be sure to subscribe to the channel if you haven't already. If you found this video useful and helpful, please like it and share it.
Together with all of your good friends, I want to add that no amount of regular physical labor can help develop and strengthen your muscles and improve your vitality and health as much as training with Dr. Chernov. Lyuba, I want to thank you very much for this wonderful promotion.
Friends, goodbye to everyone. See you next time. Stay tuned for more great new videos.